Hello and good evening. I'm Melissa Idris.
And I'm Sharad Kutan.
Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Health Minister Kari Jamaluddin has confirmed that Malaysia is facing shortages of several over-the-counter medications, such as for flu and cough syrups, medication for food poisoning, and several types of antibiotics. Now, this came after discussions with pharmaceutical associations earlier this month. The question is whether poor governance and planning is at the heart of the problem. Joining us now is Bandar Kuching MP Dr. Kelvin Yee. He is also the chairman of the Parliamentary Special Select Committee on Health, Science and Innovation. Dr. Kelvin, you had raised concerns over a medicine shortage even before the Health Ministry admitted there was one. They downplayed the seriousness of the issue. Can I ask you how and when you came to be aware that there was a problem?
I think, to be fair, this issue wasn't first, it was raised by many different parties. I think officially it was also raised by the Malaysian Association of Pharmaceutical Suppliers, MAPS, as well as the Malaysian Organization of Pharmaceutical Industries, MOPI, and of course the Pharmaceutical Association of Malaysia, Pharma. And these are the three main big players when it comes to medical supplies here in Malaysia. And actually, in the past few months, if you walked in a local pharmacy or even a 7-Eleven. Sometimes when we want to get the most basic over-the-counter medications, just like paracetamol or Panadol, or even cough syrup, we find a lack of it. You will see it empty. So, and when I also get feedbacks from local pharmacies, whether even in the local Klinik Kesehatan's government and even private GPs, they have been informing us of delayed supplies from suppliers. And this is where there is a concern. And of course, this is not just specific and not just only in Malaysia, but this is a global issue due to, of course, disruption of the supply chain due to closed borders in China, and of course, COVID-19, sudden surge of needs and also demand for certain drugs.
So, Kevin, it seems that you yourself in the Parliamentary Select Committee as an MP, but also these associations have played the vital role of warning the government about the situation. And why do you think there was pushback or denial about this? Why was the government so slow to first admit that there was a problem?
I think first and foremost, they also want to a certain extent, downplay the issue. Maybe, I'm just guessing, maybe not to create a panic among the public. Actually, medicine shortage is quite common. Actually, every year the government actually face this for certain amount of medications, especially towards the end of the year. What makes this different is because there is a huge global supply chain issue. And Malaysia as a country is very vulnerable in position as we are a net importer of pharmaceutical products. As I mentioned just now, hardcore lockdowns in China, the Russian war in Ukraine has sparked major shortages, has cut off supply chains. And because of that, I have said that this is not any ordinary medicine shortage that we face on a yearly basis. And that is why the government must come with either a short-term plan, a midterm, and even long-term to guarantee our medical security.
Dr. Kelvin, you said that we are a net importer of pharmaceutical products, is that correct?
Yes.
Okay.
Yep.
And we have had medicine shortages before. So clearly this is not an unanticipated problem. If we are a net importer and we've faced shortages before, surely we could have seen this coming. What do you think was done to anticipate this problem?
I think, as I said, nothing much was actually communicated to the public. What the Ministry of Health has, whether they have foreseen it, whether they have taken proactive steps. Fact of the matter is, as I said, I give credit where credit is done. I'm glad that the minister has met with the main players at the beginning of the month on the 2nd of July. Actually, in my view, to do an audit of actually the medicine stocks that we have both in the public and the private sector. And this is important to fully understand the extent of the shortage, if any, and also to identify where there is sufficient stocks. because we need to understand, for example, if there is a sudden surge of need in a certain area which have little stock, they can have this ring strategy where they redirect medical stocks from one place which have maybe sufficient to a place that's insufficient. So maybe the government did not foresee this. This is again a long-term issue. As I said, Malaysia's almost entire supply of finished pharmaceutical products are either directly or indirectly imported because of this, what we call the active pharmaceutical ingredients or APIs, basic ingredient to make medicines, are mainly imported, mainly from China. So we have local manufacturers, but we need to import this API to make these medications.
Calvin, can we talk about governance? I mean, is the situation in Malaysia such that only a minister can move things? Only a minister can have these conversations and monitor what actually is happening, do an audit. Is that really the job of the minister? What is the civil service doing?
Again, I'm reluctant to put all blame to the civil service, but again, I think one culture that we need to improve, and this is also evident during the COVID-19 pandemic, is that we are not proactive, in the sense that a lot of policies come due to firefighting, due to only realization of an issue when the issue happens, and most of the time it's too late. So that is where, as you mentioned, is that good governance is very important to foresee issues like this happening, because I said this supply chain disruption, China's borders closed, this actually happened months ago. So all this should have been foreseen. Short-term, mid-term, and long-term actions should be implemented in place, and hopefully this issue be addressed properly.
Calvin, what are you concerned about if the issue isn't adequately addressed? What kind of situation could we be facing?
The most basic, the fact of the matter, if we run out of medicines, then the patients will suffer. As I said, this is not any ordinary shortage of medication that we suffer on a yearly basis. This issue will permeate into all the healthcare system, whether in public and private, because many experts, even supply chain experts, have predicted that this issue will prolong until the end of the year. Because even China opening their borders right now does not mean that the issue will be resolved, because it's a complicated chain of supply. Things will need to take time to open up. And at the end of the day, patients will suffer. I mean, these are simple but important medications. Fact of the matter, today itself, there was a news report where a private clinic in Miri, Sarawak, which treat children's pediatric patients, mainly on asthma. They have run out of asthma medications, and even antibiotics and simple medications, even to treat abdominal cramps and so forth. So these are basic but important medications. So at the end of the day, the patients suffer. Even though the minister has said that the stocks of medications in the public sector is sufficient right now, but at the end it will eventually permeate, because if the private sector there is a lack, more and more patients will start going to the public sector. Then you increase the congestion in the public sector, you increase the demand in the public sector. Then if this supply chain issue is not dealt with, then again we will get the patients will suffer.
Thank you so much for joining us on the show. That was Bandar Kuching MP Dr. Calvin Yee, also chairperson of the PSC on Health, Science and Innovation. We'll be right back here and Consider This. Stay tuned. Hi, you're watching Consider This. I'm Melissa Idris. With me is Sharad Kutan. Malaysia is experiencing a shortage of common medicines across private clinics and pharmacies as a result of the global supply chain issues in the global supply chain. Now, how might this affect patient healthcare treatment if the situation persists and is prolonged? Let's ask our guest, Dr. Kuljit Singh. He is the president of the Association of Private Hospitals Malaysia. Dr. Kuljit, we understand this is a global problem. There are external factors that are in play. But what is it about Malaysia's medicine security policies that might have exacerbated the problem, what we are currently facing?
Well, first of all, thank you very much, Melissa and Sharat. The most importantly, we have seen that this medicine shortage came about immediately after the pandemic started ceasing off. When patients started coming back for treatment, back to our hospitals, both public and private, and suddenly we realized that there's not enough of medication. Now, more importantly, what we don't really have in private hospitals are the simple medications, the day-to-day medications like cough medications, fever medication, maybe some antibiotics. That is where the greatest shortage that we have seen. Having said that, it is not critical because we have looked out for alternatives, medications that we don't usually buy in private. We've gone looking for generic medications. So we are not all that bad because our load is not as high as what the government hospitals would see on a daily basis. But of course, we are worried that if it persists, whether suppliers will even have generic medications to give us in the future if things don't catch up.
So, Kuljit, to what extent could the situation have been remedied or at least mitigated by good planning? And if that's true, what does good planning look like?
Well, in private hospitals, we normally buy medications based on our needs. We know how many patients we will usually see in different parts of the year. And with that, we always have enough stock. You must remember in private, if we overbuy medications and we cannot dispense them or sell them, we lose money. So in that fact that we are very careful when we procure anything in the private hospital so that we cannot have wastage. But to plan on this was a little bit difficult because nobody knew there's going to be a global shortage. We only knew there was a global shortage when our patients started increasing in our hospitals, and suddenly the suppliers were not able to keep up with the numbers. So we planned like every year the amount of medications we require, but this time we realized that we planned it correctly, but the suppliers are not able to give us around the same amount that we normally get it every year at this point of time.
Okay, so if the situation is still under control now, at what point were you going to start to worry? How much stock is left?
Well, we are managing quite well. As I said, we have alternatives in private hospitals. We try to get the closest that where we can get. But now my worry is if this goes on for another 2 months, for example, and we do not get any supply at all, even the generics may run short, even the alternatives may run short. So I believe within a month or two, I think we should be better. I mean, normally manufacturers will ramp up their supply once they know there is a demand, but you have to just give them a little bit of time. I don't think we'll go to a critical level that there'll be zero medications left. I don't think we'll go. But I must say, medications for critical conditions, we have enough of stock of those kind of medications. Life-saving medications we have. We don't have to worry about that. And one thing good in private hospitals, we do share our stock. If one hospital doesn't have, we can very easily get it from our neighboring hospital, even though we may not belong to the same group. We always treat our patients as patients first.
Kuljit, the issue of procurement, is it limited by what government allows? Meaning, what drugs have been approved from various sources? And what do you understand about government in terms of the rate at which it's approving drugs from different sources, maybe non-traditional sources, as a remedy for any kind of supply chain disruption?
So those medications that we deem to have shortage now, we have wide range of resources to get it from. And like I'm talking about cough mixtures, fever medications, antibiotic, we have got a lot of resources that has been approved by the government. So it's not much of an issue. A lot of generic companies have already been approved by the government for years together. So you can get fever medication, various types from various sources. That is not a problem at all because there's not much of a control when it comes to these normal day-to-day medications. It only comes an issue when you go into very specific medications, which we are not at any shortage at this point of time, like, antivirals or specific antibiotics, which are only meant for specific conditions. Yes, then they will have some sort of restriction from where we can get our medications from. And usually those niche medications, the resources can be quite limited. So we are facing an issue whereby the resources are actually quite a lot, and we can actually still get it from many sources, which is approved by government.
Okay, well, so we understand that this is again to do with supply chain issues. Once that is resolved, hopefully we can see the short supply be addressed. But the question is, as I have just learned recently, that Malaysia is a net importer of pharmaceutical products. Can I ask you, to avoid this situation from happening again, what would you like to see put in place to ensure that there is some medicine security in Malaysia?
I think we need to start moving where we need to start manufacturing some of these common used medications in Malaysia itself. I think most countries do that. When you know that these medications are regularly used in large amount, so it's best to start manufacturing them locally in Malaysia. So I think that would be the better way of doing things. Like, we realize that we are the number one glove provider in the world. We never have problems locally when we want gloves. Others have problems. So in the same formula, if we think that this is going to be a frequent problem, this is only first time probably in many years that we're having this issue. Just because it's happened first time, we shouldn't then go into a big manufacturing methodology which may not be cost effective. But if it is going to be a regular issue, then I think we should start thinking of looking at local industries in manufacturing some of these drugs. And some of these drugs don't have patents anymore, and I don't see a reason why we can't do it locally. But we must look at the cost effectiveness of manufacturing our own medication for the number of population that we have in Malaysia.
Right. So, Kuljit, when you think of food security as an analog to the issue of medicine and securing supplies, the cost issue is only one component, right? You have to balance costs against vulnerabilities, and if we rely only on the cost rationale, aren't we in danger of making ourselves vulnerable to global supply chain disruptions?
Yeah, I mean, that could happen. So that's why we really need to sit down and look at this, because this is just something that has occurred for the first time, where a lot of medications have gone out of stock. So we really need to do a study and look into all those details before we make a decision that we need to do something on our own. I would put it as it's too premature to make such decisions yet, and let's watch and see how it goes. If everything goes back fine, then we can go back to our old a way of procuring medications from internationally, because that's probably a better way. We can always concentrate on other areas that we are good in. So I think it is too early to make that assumption, but let's see how it goes in the next couple of months.
Okay, thank you so much, Dr. Kuljit, for joining us on the show today. Dr. Kuljit Singh, President of the Association of Private Hospitals Malaysia. Stay tuned to consider this. We will be right back with more on this topic. Hi, thanks so much for staying with Shrad and I on Consider This. Joining us now, we have Nur Haliza A. Halim. She's a Senior Director of Pharmaceutical Services under the Ministry of Health. Puan Haliza, thank you for joining us today. Can I begin by asking why the Health Ministry initially refuted claims that there was a shortage in medicine supply, but only to be confirmed that there was a problem by the minister just a few days later? Why were these concerns downplayed initially?
Because initially when we have a complaint from the ground, we do check with the supplier side, and then in general they claim that a few of the items that is claimed in the list, it's no total stock disruption. But we are also still on communication with those parties to see what is the problem behind the scene, whether we can some might need some interaction from government interfere to solve the problem, but some majority of the thing is already been taken care of by the industry themselves. Like for example, if the source of the problem is due to temporary lack of APIs or raw materials, they already put up extra orders and so on.
Do you think that the ministry has adequate monitoring of supplies, that it can in fact anticipate problems as they arrive and find solutions to the supply chain disruptions or distribution issues?
I think for the Ministry of Health stock, we don't have much problem because we have a system in place. In fact, those items that are already in our central contracts, we do monthly monitoring, and then our suppliers also should abide to our requirements for them to report whenever there is a shortage anywhere in the supply system. But for the private sectors, when we have some interaction by any methods of complaint, we have to approach each individual suppliers and even the product registration holders, and then we are doing that ongoing, and then we try to solve in general.
Yeah. Well, pharmaceutical procurement, I imagine, must be quite complex because you're thinking about storage, but also the shelf life of this of the products. Can I ask you, when you look at the supply chain as a whole, where are the concerns? Because again, this is a global issue. What kind of time frame are you looking at for this supply shortage to be resolved?
Is supply shortage to be resolved? It depends on which item you're talking about, because some of it is temporary, like they Taiwan and they got some temporary lockdown. So some of the raw material from that side already interrupted for a while, but now it's resumed. Then they're picking up the production. But if the item is shortage everywhere in the world, we have to find another alternative, maybe another active ingredient, because with the same indication, it's not necessarily, because sometimes some of the items we have many registered brand in Malaysia. So for example, we have certain numbers of registered item, and then not all of them are interrupted. Then maybe we have to share the info later on with the industry players.
One, do you think we have left ourselves vulnerable? We are a net importer of pharmaceuticals. Is that a good position for any country to be in?
Which country you mean?
Malaysia. We are a net importer of medicines. It's made us vulnerable to supply chain disruptions and other issues. Is this a good situation? And if not, what should we have done about it?
I think actually is in our national medicine policy, we already put up a policy whereby as far as we are concerned, we need to enhance our local production, to reduce dependent on the import product. But having said that, even though we increase our local production, majority of our raw materials is still, especially active pharmaceutical ingredient, is still imported items. So it's it's a vicious cycle. But of course, we are working very hard to improve our self-sustainability.
Right. When we look at the current pool of medicines at the moment, some that may be in short supply, some that we still have an adequate supply, how does the procurement process actually ensure that there is an adequate supply to all parts and all levels, at state level, at district level, at rural level, at urban level? Is there a mapping out of where these resources will be channeled?
You're talking about our Ministry of Health facilities?
Correct, yes. Ministry of Health
Ministry
Facilities.
of Health Facilities, in principle, we have, three main methods of purchasing. One is through the concessionaires, which is from Pharmaniaga. And then the other group of item is under central contract, which is awarded to various suppliers. Usually, we bind them with a certain specific agreement for 2 or 3 years period. So the price, the delivery period, they have to abide on that. Then is already stipulated in the contract. So that part, like I said before, for central contract items, they have to report to us monthly the situation, and then whenever they feel there is a global shortage, what is their duty to report to us, and then we find a solution. Because sometimes if you cannot get from country A, you have to get from country B, all the alternative supplies.
Okay, thank you,
But
Puan Nurhaliza.
for district level, they have their own power to purchase all the, we call it low value items. They purchase on their own. Like our hospitals, they have they can purchase certain items that is not in the central contract. That one no problem.
Okay, Puan Haliza, thank you so much for joining us on the show today. That was Nurhaliza Halim, Senior Director of Pharmaceutical Services under the Ministry of Health. And that's all we have for you on this episode of Consider This. I'm Melissa Idris.
I'm Sharad Kuttan, signing off for the evening.
Thank you so much for watching, and good night.